Welcome to this new season of the show. This time we come back with a new name, Health Check. In this new exciting season, we've decided to do things a little bit differently. We're going to be checking in on your health at home. My trusted colleague, Dr. Nosipho Mhlanga, will be our very own field doctor. And together, we'll be feeling the pulse of the nation. Every Sunday at 11 a.m. on SABC2. In today's episode, we'll be discussing a concerning issue that affects millions of people in South Africa, diabetes. My colleague, Dr. Nosipho, went out to speak to a mother of three who's been dealing with diabetes since 2006. Dr. Nosipho, tell us what you found.
Thank you, Dr. Silo. And today we're in the East Rand, all the way in Davidton, and we're about to meet Hilda Ndombi, a woman with a challenging journey living with diabetes. Let's go do a health check-in on her and her family to see how they're managing with her condition.
Because there are days I cannot wake up. Yeah, like you wake up in the morning, you feel like I'm dizzy. I stay in bed, they bring everything there. I'm staying with my 3 daughters, 2 grandchildren. They're helping me, all of them. It's because I'm no longer strong to stand up on my own. Most of the time, when I'm inside the house, I'm using my knees to go to the toilet because I feel like it's slowly for me. It's faster when I just went down and ran to the toilet. As we figure into emotionally one, ngokuthi nje ingqondo lisebenza usathana. Ngoba uzibuza into eziningi mara ngiphilelani sengiso mara why mina ikaningi ke lo question kimi ukuthi why mina. Yeah, my name is Hilda Mdlese. Phumzile ngizanele no Amelia nabazukulu bami bayi-2. Mina diabetic.
Then before uqala ukugula ma, ungasitshela ukuthi impilo yakho beyinjani before you even got your diagnosis le ye-diabetes?
Bengiphila nje impilo right ejwayelekile. Just nje mangithola my firstborn kulaba sola ngathi ngine-high blood. It was 91.
Kunini lapho uqala ukubona khona ukuthi hayi ngathi khona inkinga la emzimbeni ngizibona ngathi ngiyagula?
Kusho ukuthi it was 2006. Ngabo November so ngaqala ukuthi ngilahlekelwe eyesight. Khona ukubona moseduzane into esekudeni ngingayiboni. Kula ngaqala khona ukusola mangizohamba ngeclinic. Bathola ukuthi diabetic.
Bokuhamehlo nje kuphela beyakuhlupha ngaleso sikhathi.
Ngahlisha amehlo kuphela.
Then ngesikhathi ke wena uthola ukuthi unoshukela. Lelo langa mhlambe mawukhumbula lalinjani, wazizwa kanjani? Yini into ebeyisemizweni yakho, yini into oboyicabanga ngaleso sikhathi?
Cabanga ukufa kuqala ukuthi ngizofa. Ngoba angithi ukugula esihlangabezana nakho. Vele ukuthi yazi ngizofa ithi ngizame ngalendlela ukuthi maybe ngigweme lokugula lokhu.
And then emzimbeni khona bowuphila kanjani? Bowu-exercise ngaleso sikhathi, benidla kahle noma beniphila nje njengabantu?
Siphila nje impilo ejwayelekile right njengabanye abantu. Exercise lokushini yabona inkinga.
So i-routine yakho ke impilo ishintshe kanjani mihla namalanga masohlaba ama-injections?
Kuyashintsha ngoba okokuqala nje uyayikhohlwa. Okokuqala nje uyakhohlwa kwesinye isikhathi. But kwaya kancane kancane ngibe ngijwayele.
Kwaba ingxenye yempilo yakho. And then after that njengoba sesiqalile i-treatment ke sisebenzisa ama-injections, konke kahamba kahle ngesifo sakho noma kwaba ney'nkinga endleleni?
Uyahlangabezana ney'nkinga kwesinye isikhathi uma unesifo soshukela because ngazitshela ukuthi ngidle kahle namhlanje. Uma uthi uyafika kudokotela awudlanga kahle. Ukhuphukile. Kwesinye isikhathi uzitshela ukuthi hayi ngiyadla ngoba vele unenkinga mhlawumbe ushukela ngoba uzitshela into eziningi. Uma ufika ukahle ushukela.
But endleleni ke kwaba nento entsha mhlambe beyikuhlupha inyawo emzimbeni or something like that?
Angizange ngayazi until 2020 August. Ngiqala ukubona ukuthi lo nyawo lolu seqala ukuba ngenye indlela. because mangifaka isicathulo esivalekile buthola mangifika la ngiyakhona kufanele ngisikhumule ngoba lo muno lo omkhulu wakulo nyawo une-pain. And then lapho ngo-August ngathola ukuthi lo muno la ngaphansi la sodabukile-ke futhi akusalungi makuqala u-October ngihlalile ngathi iviki eli-1 ku-October kwelesi-2 bese bangizamela iplani yokuthi mangihambe nge-Eden Vale esibhedlela bayobona indaba yonyawo. Mangifike e-Eden Vale thola ukuthi bathi angeke lisalunga indlela abanganginceda ngayo kuba unqumo.
Wazizwa njani wena ngaleso sikhathi bakutshela ukuthi inyawo lakho kuyomele balinqume?
Kwaba nzima kakhulu, kwaba nzima. Ngabona khona ukuthi akusalungi. It was the 12th of October. Angizange ngikholwe vele qale indaba ukuthi ngizoyonqunywa. Kwaba nzima kakhulu. Kusho ukuthi emva kokunqunywa konyawo ne ngacabanga ukuthi ngifike ekugcineni. Yeah, because mina ngumuntu ohambayo ngisitoke phume ngidayisele kwavele kwama kwaba inkinga kakhulu ya omunye wenyawo ngaba nalento ukuthi makungenzeka uGovernment angiphe unyawo kuzobuyela kube ngcono noma ngeke kusafana ukuhamba but kungashintsha la kufuna ukushintsha khona because into eziningi ziyashintsha kwamampela ziyashintsha. Nabanye abantu bakubona ngenye indlela abasakuboni ngale bebakubona ngayo kuqala.
After the break, Hilda continues to tell us how she manages to stay mobile, and we speak to public health specialist Dr. Patrick Poiti.
Siyabonga kakhulu ukuthi amukele emzini wenu. So ningasitshela ukuthi ngiyakhumbula isikhathi umama angakaqala ukugula beyinjani impilo?
Impilo beyinormal beyikahle. Bejwayelekile se-right enenkinga into beyi-right.
Ngaleso sikhathi ke athola ukuthi unoshukela khona ngesikhathi ahamba wayothesta eklinika angasaboni. Yaniphatha kanjani leyo nto leyo?
Ngibona njengesifo esiyingozi. Esiyingozi kakhulu ukudlula isifo ekuthiwa zikhona emhlabeni. If I can count, diabetes isifo esiyingozi kakhulu because ngokusibona kwami asifuni isilonda emzimbeni womuntu. And if kwenzeka bathi uma i-diabetes manje, I could try ukuthi ngibe more careful than manje because ngiyabona ukuthi i-affecte umami kanjani.
Wena Zanele?
Mina angazi, but I don't think ukuthi mina ushukela uzomphatha. Angicabanga njani.
Ngibona ngathi uyazama ukudla ngendlela.
Yeah, ngoba ngiyazama ukudla ngendlela. And uyazi angeke sonke endlini sivume ukuthi siphathwe into eyi-one. Family vele nathi sizinakekela. Because angithi sifunda kule nto eyenzekile kuqala ukuthi nathi ingayenzeki kithi.
Hearing about Hilda's harrowing story, it's clear that her diagnosis and its aftermath have had a ripple effect on her and her family. And with such an uncertain future ahead, I'm really encouraged to see how she stays so strong in her faith and remains resilient.
Welcome back, and thank you for staying with Health Check. According to the International Diabetes Federation, 1 in 9 people in South Africa have diabetes. It's the highest diabetes prevalence rate in Africa. Just under half of the people living with diabetes in South Africa are undiagnosed. It is one of the 3 leading causes of death in the country. So Dr. Nosipho has joined me in studio to share her experience about the health check-in she conducted with Hilda's family. And I'm also joined by Dr. Patrick Poiti, who is a qualified medical doctor and a public health specialist, and is also currently Senior Program Manager at the University of Pretoria Diabetes Research Center. Dr. Patrick Poiti, welcome to our show.
Thank you, Dr. Silo. Nice to be here with you guys.
All right, so today we're talking about a really interesting but serious medical condition called diabetes. First of all, just tell us exactly what this condition is. People call it ishukela, swegili, sifo shukela, tsukiri. What exactly is this condition?
Diabetes is actually a condition or a group of conditions that are manifested by a high level of sugar in the blood. So that's the main manifestation biologically. But it's the reason behind that is that sometimes the insulin from the pancreas is not secreted properly, or when it's present, it's not working properly, meaning facilitating the transfer of sugar from the blood to the cells or the body parts that actually needs it for energy.
All right. Okay. So we hear that there's different types of diabetes. Just briefly, what are these different types?
Yeah, there are different types of diabetes, as you say. We can group them with type 1. Type 1 is a type of diabetes that usually you find in the person of a younger age, anything from 7, 8, 11, up to now 30 years old. We even found people of an older age with type 1 diabetes. Type 2 diabetes, on the contrary, was described originally as a diabetes of the old age, 40 years old and above. But now, with our obesity epidemic all over the world, you find people with 18 years and younger developing type 2 diabetes, but that wasn't the case before.
All right, let's talk numbers now. How common is this condition? We hear that 96,000 people die every year because of this condition. But what sort of numbers are we talking about? Do we know the full extent of this condition in our country?
Unfortunately, we're using estimates. In South Africa, for example, the data around diabetes is not quite clear, and this may be something we can address later on in terms of diabetes surveillance. It's estimated about 4.2 million South Africans are living with diabetes. And the key element here is that 1 out of 2 are unaware of their diagnosis. So it's quite a prominent health condition.
And you mentioned that about 4.2 million South Africans are living with diabetes, and half of those, 1 in 2, don't know they have it. Why is it that people don't know they have diabetes with so much awareness going around?
Diabetes is typically described as a silent disease. The fact, for example, when you focus on type 2, which represent 90% of cases of diabetes, for a number of years, the individual can live a normal life, not knowing or not picking up on those symptoms that indicative of the person having diabetes.
So we'll come back to, you mentioned the question of complications. We'll come back to that a little bit later. But let's talk about the symptoms that you mentioned. You mentioned some typical symptoms. I guess people watching this show would want to know, okay, how will I know that I now have diabetes, other than, of course, screening that we spoke about? What are the typical symptoms of diabetes?
Thank you, Doc, for this question. So we said initially that it's linked to the high blood sugar, high level of sugar in the blood. That, for example, leads to somebody drinking a lot of water because the body wants to compensate or to dilute that sugar in the blood. And then obviously, if you drink a lot of water, you urinate a lot. So somebody will be going to the toilet a lot, maybe at night. This is something to be paying attention to. There's also the hunger. Somebody who has a lot of sugar in the blood, but the body is not using it, he receives a signal. This body is telling him to consume more food. Meanwhile, it's because of the body not using sugar. So,
but what's the importance of treating early? And if remaining untreated, what are the long-term consequences?
Diabetes untreated can become very, very catastrophic because that state of high sugar in the blood will actually affect a lot of organs, what we call target organs, from your brain to the eyes, to the extremities, your nerves, and so on. So it's very important that once diagnosed, the condition be managed properly by obviously various factors that we'll probably discuss.
So with patients that are already on treatment, what could cause a patient not to be well controlled and eventually develop complications even when they take their medication consistently?
No, thank you. That's very critical. Our research at the University of Pretoria Diabetes Research Center found that 7 out of 10 patients in the primary care sector are actually poorly controlled. And we found that there are many factors. For example, I want to talk about patient education and empowerment. I don't know if it was the case in the case study, but because of the constraints in the public health sector, sometimes we need to be honest as healthcare professionals. Because of the lack of knowledge of the healthcare professionals, patients are sometimes not empowered enough, not educated enough. They're not told what is diabetes, how do you manage it, what to look out for. Not only the patient, but actually the whole family, because they need that support from the family. So that's one of the factors of patient empowerment. So as healthcare professionals, we need to prepare them for that eventually of insulin, and obviously make sure that they are controlled and their blood sugar are really kept under control.
Coming up next, we see how Dr. Nosipho concluded the health check-in, and Dr. Patrick gives us his final thoughts.
Azangazi njengoba usulibona-ke Lundle senabe ngibona funa ukulandela kuloliya ngendlela ekwenzeka ngayo kulolu nonyawo la.
Ikuphatha kanjani leyo nto leyo?
Hey, eqinisweni nje mina ngithanda ukukhala, ngivele ngikhale ngibona kahle ukuthi kusho ukuthi ngifike ekugcineni ngoba mabangalinquma nalolu ngisho ukuthi mabangalinquma nalo akuphelile.
We can see that diabetes runs in this family, and even with a first-hand experience of how devastating this disease can be, it's still really difficult for people to make the right lifestyle changes.
Dr. Nosipho, you spent some time with Hilda, also known as Ndombi, in Davidton recently. So in the context of our discussion, what are your impressions of Ndombi, and what learnings can everybody watching this program benefit from?
So with the pattern of risk factors that you were speaking about, that's exactly our case study story. So her grandmother had diabetes, an aunt had diabetes, she had diabetes, and the whole family has a metabolic phenotype. So they are overweight, and they mentioned a lot about the financial constraints, so their diets are not good. So they are really high risk.
Obviously, there's a level of stigma associated to diabetes. So that may be the reason why the family member are a bit reluctant. So there are those measures that should accompany with raising awareness, the campaigns, but also the support for those families that has been affected so that they can understand that it's not a fatality, as the doctor mentioned earlier in our conversations, that there is help that they can get if they are diagnosed with diabetes.
We've heard recently, not recently, in fact, all the time, the link between diabetes and mental health conditions. Do you want to perhaps just comment briefly on that?
It's very important, Doc, that you're raising that issue. At the University of Pretoria Diabetes Research Center, we're actually starting a cluster on mental health and well-being, focusing on those challenges that people living with diabetes have. For example, there's what is called diabetes distress, whereby you can imagine the pressure on a daily basis, what to eat, what not to eat, the feeling of guilt when you have a bar of chocolate, the feeling of guilt when you didn't get out in the morning to have a walk, and then not to forget the medication. And there's so much that they are going through, let alone the fact that they sometimes don't get that support from the family. So as healthcare providers, we need to start thinking about mental health and well-being, the person as a whole. There might be issues that are not just to be dealt with pills or with an injection. And it's also with counseling and conversation with the person with diabetes that you might pick up those issues.
Just to tie in from our case study, she did mention that she went through a major depression throughout the journey. In the beginning, she felt a lot better. She was confident, but as the disease progressed and her leg progressed to get worse and eventually she got amputated, she was really struggling with her mental health. And it also showed how it was affecting her family because her daughters also seem to have a lot of bottled up emotion that they don't express in the home, and they struggle to communicate with each other in the home. Supportively, though,
So they do support her a lot. They help her with the medication. But we did ask a question whether or not they think they would benefit from psychology. And they really did say that. And even me as a practitioner, I've never sat and thought maybe I should refer my diabetic patient to a psychologist, because we're not thinking beyond what is your sugar today, what is your HbA1c, we only end it there. So I think that would be a very big initiative that would change a lot of patients' lives living with chronic diseases.
Indeed, Dr. Nosipo, the importance of involving people living with diabetes and their families in their own care. That we talk about meaningful engagement, to have them have their say. To say, for example, yes, I'm taking care of my pills. I want somebody to listen to me. I want somebody to understand that I'm suffering. I want somebody to understand that there are challenges that are beyond only the tablets and the injection. So it's really important that we give them space to express themselves as people living with diabetes. The condition or the living live experience is something that we might not have, but it's critical, as you see, to say, doctor, actually, I'm suffering mentally. And this is, as healthcare providers, and obviously as the whole society, we need to understand that these are people. Besides having diabetes, they also have challenges at work, in the relationship, and elsewhere. And they need really that extra help. And for us to understand that sometimes they might need a consultation with a psychologist. And to just bounce on that, as the Diabetes Alliance, we are planning towards the end of the year a summit where we're really welcoming people living with diabetes at the Diabetes Summit to share their life experience and to talk to the whole players and the policymakers on what actually they want to see happening for the diabetes situation in the country to improve.
I think that's a very good note to conclude our conversation this morning. Dr. Ngasa Bioti, thank you very much for your time.
Thank you, Dr. Sello.
Thank you.
Thank you, Dr.
Follow and engage with us on Health Check SA on all social media platforms. Ask questions or comment about your thoughts regarding diabetes in South Africa or your own experiences with family members or friends who live with this condition. The World Health Organization, or WHO, has confirmed that the incidence of diabetes is rising around the world, and studies have shown that children are becoming at increased risk of developing this disease. It's for this reason, therefore, that as parents and elders in our communities, we set better examples to our children and take action with our lives. This is Dr. Sello Mutelo, and you've been watching Health Check. And until next week, stay healthy, stay vibrant, and always check in on your health.